I've been getting a lot of questions about statins recently. David Hitchcock asked the question, he said, Dr. Brewer, you've mentioned in your other videos that you use a lot of rosuvastatin. Rosuvastatin is the generic name for Crestor. It lost its patent a couple of years ago, and it usually takes about 2 years for the price to drop, and that's exactly what's happened with Crestor. It used to be far more expensive a couple of years ago, and that became a major issue. We looked at genetics and other things to just try to decide whether or not we used simvastatin, pravastatin, or Crestor. I'll actually talk about the pros and cons of those statins, as well as Livalo, which is a new one. And because it's new and because of some of its advantages, very expensive. I'll talk about more of an overall comparison in a future video. However, today I'm answering David Hitchcock's question. He goes on to say, you mentioned rosuvastatin for protection of inflammation. However, you didn't mention the dose. Do you think 5 milligrams or even 2.5 milligrams daily would be enough? Ford Brewer, Prevmed, heart attack, stroke prevention, disability prevention, cancer prevention. We can help you get there in terms of adding 2 or more healthy decades to your life. Now, so again, today we're talking about dosing for rosuvastatin. Rosuvastatin, we can actually even give on an every other day basis. A lot of folks we will put on rosuvastatin Monday, Wednesday, and Friday, or every other day. Now, why is that? It's got a half-life of 17 hours. What does half-life mean? Well, half-life means the time that it takes for half of the medication to be excreted or metabolized or broken down, made or neutralized, made where it's not being used anymore or affecting the body anymore. So with a half-life of 17 hours, you can see that you can take it on Wednesday and you're still having some significant effect all the way over to Friday, or Friday and all the way over to Monday, because really, and here's why. Very low doses of rosuvastatin are fine for inflammation. So speaking of inflammation, that's really how we decide our dose. It depends on the patient. If the patient has low inflammation indicators, then we'll look for LDL, because even if the patient has low inflammation indicators and they have they're one of those few patients that has very significant problems with LDL, we'll still have to use higher doses. But if, like most patients, you don't have really big problems with LDL, and if, like many patients, you don't have a lot of inflammation, then we can give you lower doses. Now, it brings up another point about doses and side effects. A lot of the side effects for statins, yes, are associated with dosing. So you get more problems with myositis, myopathy, muscle cramps, and especially that push towards diabetes at higher doses. So yes, David Hitchcock, it's a good thing to try to get lower doses, and we clearly can do that with rosuvastatin. At the lower doses, it doesn't move you along that diabetes highway. It's got less side effects. And again, we have a lot of patients on 2.5 milligrams 3 times a week. I have even heard, and my friends Brad and Bale and Amy Doneen will talk about some little old ladies that had some muscle problems and cramping and fatigue, and they got to the point where they were just having them lick the tablet 3 times a week, and they saw their inflammation numbers go down. I haven't gotten that far yet in terms of that low a dose, but I don't disbelieve it. Thank you for your question, Mr. Hitchcock.